Most times I remember to record, and then we post those on our Google Drive and also on our public facing website so that folks who might have a firewall to Google could still download and access those materials. And then we also heard from you that it might be helpful to have different types of breakout sessions throughout these meetings. So looking at, hospital settings, maybe a large hospital system breakout, and then some smaller rural ones, community mental health centers, federally qualified health centers. And so really looking at these systems that you all are working in are different, but we don't want to lose the expertise and knowledge of the big group and kind of the ideas that you share across, because I think we've seen some really cool innovations and collaborations that you all have shared in this space. Okay, so those were the themes that we previously heard from you several months ago. Also acknowledging that we have a lot more folks who have joined this monthly learning collaborative, and so we want to get all of your ideas captured before we solidify a plan. So some of the ideas that we have tentatively planned for the remainder of this calendar year is focusing in August. Potentially, we haven't locked these in, but there's some emerging research in peer support and lived experience. And so wanting to bring that information to the table potentially in August, thinking about training and kind of how we're using the workforce survey, how often are you deploying that, how are you getting folks to take it, and then what training plans are we crafting, both on the clinical and non-clinical end. In October, pending some publication, I think we should have some finalized research, and we wanted to share some of the lessons learned through that, particularly as it relates to screening men in the middle years, who that demographic continues to make up the highest rate and largest number of suicide fatalities that we have here in Colorado and nationally. And so thinking about how we might adapt screening questions or screening protocols so that we're not missing folks. November, service members and veterans. When I was looking at the calendar, I remember that the fourth Thursday of November happens to fall on a holiday. So we will likely be picking a different date for that. We are open to suggestions. If you have standing meetings that we should schedule around, feel free to share those barriers with us so that we can be mindful as we pick another date. And then December, focusing on caring contacts and all of the ways you all are employing tactics to follow up with folks and let them know that you see them, you hear them, and you're thinking about them. And I know there's a million different ways that you all are making that happen. So those are our tentative plans. We also have some feelers out. So I know we heard from you all that hearing from Barbara Stanley of the Stanley and Brown Safety Plan to do a brief workshop on safety planning, collaborative safety planning would be helpful. So we are still trying to lock down a date with her. Hopefully that's still something you want to hear about. For those of you who have seen the suicide care pathway of the Children's Hospital of Philadelphia, it is robust with a capital R. And so hearing from them and their team around what decisions they made along the way to make that really robust care plan across their system. The lessons learned, successes, all of those things. They have a fabulous team out there. Parkland Hospital, and I'm blanking on the state that is from, it's from another state, but really hearing how they deployed universal screening across their system and the impact that had and didn't have to their workflow. I think they learned some surprising things, that it wasn't as big of an impact as previously anticipated. And then hearing from some other systems in other states who are at different spots in implementation, kind of pulling the lessons learned and successes that they've had. So hearing from them. So those are our free floating ideas. All right, so now is the section, hopefully an interactive session, We have a few poll questions to hear from you all as far as what you might need from our team. We are here to support you, to help bring in additional resources, experts, tools, funding, you name it. That's our job, to help you all do yours. And so let's see if I can figure out the polls. Our first one is around the lead element. And so can you all see a poll? Yeah, okay. So I'll leave it up for maybe 45 seconds, but really wanting to hear from you all if any of these discussion topics or presentations would be of interest to you or your organization. And if you have other ideas, have something brilliant to share, or a burning question that you want to hear from other organizations about, feel free to pop it in the chat. See a few folks still selecting. Give it another 5 seconds. Okay. So it looks like overall, building the implementation team, hearing from others on strategies to get folks to the table and maybe keep them at the table might be a helpful topic to discuss as a group. And then kind of trailing behind was other kind of topics with the lead element. So thank you. Again, if you have other ideas at any point, pop them in the chat. The next one is on training. So which of the following would be helpful for you or your organization in terms of your implementation approach? Would it be helpful for us to bring to the state more free gatekeeper training resources, more free clinical training resources? Maybe just a quick overview of what already exists, or other ideas that you all have. And for anyone that has joined recently, if you haven't already checked in and typed your name and organization in the chat, please feel free to do so. Leave this up for a few more moments. Might also be a good opportunity to remind folks that we still have a bank of free online gatekeeper training resources. They haven't been gobbled up as quickly as we thought, and so get them while they're hot. First come, first serve basis. Diamond, if you want to pop the link into the chat where folks can access those, feel free to take advantage of those. We can't really buy more until we use up what we got in terms of those gatekeeper ones. So it looks like the biggest need might be around more free clinical training resources, which is great to hear. We do have kind of that treatment end of the clinical care training with the CAMs, but I know that that isn't always the right training, especially for our hospital friends that might not be providing continuing treatment services. So that's good to know. All right, the next one, and identify which of those might be helpful presentations or discussion topics. I'll go ahead and leave it up for about 45 seconds, just since there's a few sections for folks to read through. don't want to jinx it, but it sounds like my dog has finally stopped barking in her kennel, which is a miracle. All right. So it looks like chit-chatting about assessment tips is coming in at the most kind of frequently endorsed item or presentation that would be helpful, followed by screening tools overview and then screening men in the middle year. And again, if you have other ideas, don't be shy. Okay, this one is a long one. The next one is around engage. And so I might leave it open for maybe a minute and a half since there's several topics on there. And so the first one I really wanted to get y'all's take on. There is that Stanley and Brown safety plan that I think is the most widely used here in Colorado. But I was wondering if it would be helpful to have a Colorado specific one that might pre-populate some of the statewide, regional, and local resources, as well as information on those advanced psychiatric directives that not all clients might be familiar with as a tool available to them. Awesome. Thanks, Darcy and Michelle. And we, of course, would want to make sure that that is fully embeddable, if I can use that word, into your electronic health record system so that it's a usable template for you and your client. I'll go ahead and leave this open for another 15 seconds or so. Right. I will go ahead and share that information back with you all. It looks like there was some interest in that Colorado specific template. If anyone is interested in helping out on that project and sharing your expertise, that would be fantastic if you're interested. But we will move forward and see what that might look like here in Colorado. And then there's some other topics that looked like they might be of interest to folks. The next one is on treat. Just one idea in there so far. I know our rockstar friends at Jefferson Center for Mental Health had a question around, folks that are using CAMS, what does that look like in your organization? Which of the kind of different modalities are you utilizing? The online, the in-person, the case consultations? For folks that were on our academy last week, you probably heard Darylyn share that they have a CAMS book club, which sounds delightful. So just really wanting to see if that is of interest to folks. It looks like yes. Great. We will move forward with that. Trucking right along. The next one is a poll on transition, which also we have one idea around. Just hearing from you all. What caring contacts are you employing? Is it a postcard? Is it a telephone call? Is it working with Rocky Mountain Crisis Partners to provide that caring contact after discharge from an emergency department setting? Is it a text? A wallet card? Anything? Right? Steve, I love that idea. The brief CBT for suicide prevention. We will explore what that looks like. and see if we can bring that here to Colorado for you all. Thanks, Kayla. Okay, rocking and rolling, moving right along. The last one is improve, and there's a few options there, so I'll leave it open for just under a minute. All right, it looks like talking about tracking. How are we utilizing the data from those data elements worksheet to investigate and be curious around equity? Who are we missing? Who are we not serving? Are the policies and workflows working for everyone? Or are we missing different groups? Okay, I think that is all of our polls. Thank you for participating in our interactive portion of the Learning Collaborative. It was really helpful for us to hear from you all around what we have plans that might not be resonating and other ideas that we could bring to the table or just bring to Colorado in general as far as resources. So thank you for sharing. And at any time, if you have other ideas or if this spurs some thoughts after the meeting, please reach out, let us know. Feel free to help us out, bring you all the content that you're looking for. So thank you. Last, I just wanted to share some updates with you all. We do have those free training resources. We have the Bank of Military Cultural Competence training from Psych Armor that is free for any Colorado organization for their staff. And it's really exciting, but starting later this fall, our national partners are going to make it available for everyone across the country, but we'll still be able to track those Colorado course completions. So you'll still have access to that and that core bank of trainings that's available, which is really exciting. Gotcha. Thanks, Deb and Steve. We have those Gatekeeper training resources that Diamond and Corinne shared. And then we also have hard copy resources for folks that might be helpful in terms of handing out to your clients upon discharge or at any other time. We have some lethal means safety information for families and individuals to consider in terms of temporary safe storage options. We do have, I think, currently some mental health first aid booklets. If you all are gearing up for a mental health first aid training, we have access to some of those. And then we may be getting some additional QPR booklets in the future. I think we went through our stack, but if folks are utilizing them, we'll probably keep them on hand in case that's helpful. And then we do have our Colorado Zero Suicide website up and running, again, for those folks that have firewalls that prevent them from accessing a Google Drive. That's not helpful. But as always, there's a whole ton of resources on the National Zero Suicide website. Really great conversations happening even this week around screening, assessment, things like that on the Zero Suicide listserv. If you're not signed up for those, definitely encourage you to. There's a whole network of folks across the country who are implementing the framework and have ideas, questions, innovations that they are sharing on that listserv on a daily basis. All right, so our next meeting, which is scheduled for Thursday, August, I believe, 26th from 10 to 11. We have a tentative speaker potentially lined up around new research and evidence around utilizing peer support and lived experience. So I will let you know if we lock that in, but we'll take a look at the poll results as well to try to get, the training calendar set up for the year so that you all can plan which ones you really want to attend in person, which ones maybe you want to just catch the recording later, or if there's other team members that you want to bring in based on the content. So rather than utilize the additional 25 minutes, we'll give that back to you in your day, unless you wanted to stay and chit chat, chat with Conlon, see if he'll bring Denali on camera, who knows. But we're here for you if you want to chat about anything or questions that came up. But otherwise, thank you for participating and sharing what you all want to get out of this experience and how we can be helpful.
Thanks, Sarah.
Thanks, Jen.